Hi, good day. My name is Conor Maguire. I'm a doctoral student in the School of Counselling Psychology here in Trinity College Dublin. And today I'm presenting on attitudes towards inclusive education among Bulgarian kindergartens. This study was born from a joint project between UNICEF and Bulgaria's Ministry of Education and Science. The project was called Together from Kindergarten, and it sought to pilot a model of inclusive education in kindergartens in Bulgaria. So the context of this project is that since 2012, Bulgaria has been moving towards a more inclusive framework in educational settings, following the country's ratification of the United Nations Convention on the Rights of the Person with Disabilities and the principles of the Salamanca Statement. These changes occurred within a broader shift taking place, moving away from a medical model of disability, as the country increasingly embraces a human rights framework to inform legislative reform. So when we speak about inclusion in this context, we are drawing a very firm distinction between integration and inclusion. So integration can be understood as simply the physical placing of a student with additional needs into a mainstream classroom so that they receive their education alongside their peers. However, this does not meet the definition of inclusion that we are advocating in keeping with the human rights framework. Inclusion means, among other things, making necessary adaptations to the classroom environment, curriculum, teaching practice, and routine so that those children with special needs are supported to learn to their best potential. This definition follows the movement towards a social model where institutions are seen as having the responsibility to make the necessary changes so that all students' rights to education are fully realized and enjoyed. So the present study examined the attitudes of kindergarten teachers in Bulgaria towards inclusive education. By understanding how relevant stakeholders in educational settings think and feel about inclusion, future educational reforms will be better placed to develop targeted interventions for promoting inclusive practices. So to examine attitudes, Ajzen's theory of planned behavior was used because it allows us to investigate the relationships between attitudes and behavior. We recognize that attitudes are formed within particular historical and cultural contexts. However, it is important for progress that we recognize how attitudes can also develop from interactions between knowledge, skill, and experience. Taken from the work of Eagley and Shaken, a multi-component model of attitude formation proposes that attitudes are comprised of cognitive, affective, and behavioral components. Central to our study was the ultimate aim of impacting teaching practice and informing policy. Therefore, we investigated the constituent components of attitudes of teachers towards inclusion so that targeted interventions can be delivered to promote inclusive attitudes and more inclusive practices in the classroom. The three variables we measured in this study were attitudes across the three constitutive dimensions of cognitive, affective, and behavioral. We also measured teachers' concerns about inclusive education, as well as teachers' self-efficacy to teach in inclusive settings. Attitudes were measured using an adaptation of the MAPIs, which is the multidimensional attitudes towards preschool inclusive education, developed by Lohman and colleagues in 2016. Teacher concerns then were measured by the concerns about inclusive education scale, and self-efficacy was measured with the teacher efficacy for inclusive practices measured. So overall, to talk through the findings, the results indicated that teachers generally in kindergarten held positive attitudes towards inclusive education, with the strongest dimensional component being behavioral attitudes, meaning that teachers were most likely to change their behavior to facilitate inclusion of students with special educational needs. The cognitive and affective components, that is how much teachers positively think and feel about inclusion, tended to be more negative. However, the three components were positively associated with each other, so we know that efforts to improve teachers' attitudes in one of the dimensions might also facilitate improvement in the other dimensions, thereby strengthening overall attitudes to inclusion. Teachers from rural schools tended to hold more positive attitudes towards inclusion, which may be explained by the tendency of smaller, slightly less well-resourced rural communities to have stronger bonds within the community network and to offer more supports to students with special needs and their families. Additionally, and most critically for the overall purposes of our study, teachers who had engaged in pre-service inclusion-related training tended to hold more positive attitudes towards inclusion overall than those who did not receive this training. There was also a positive effect of in-service inclusion-related training. Further results showed that the more experience a teacher had working with special educational needs, the more likely they were to positively endorse inclusion, particularly in the behavioral dimension. Teachers also mostly reported high self-efficacy, while those with more concerns about inclusion were more likely to report lower self-efficacy. Additional findings noted that a small number of students in the kindergartens which participated in our study spoke Bulgarian as a second language. So these students would mostly be coming from the Roma community. These families and children from this community face significant barriers to accessing education, particularly kindergarten education. It has been found that children from the Roma community are 50% less likely to attend kindergarten than their peers from other communities. Therefore, children from the Roma community with additional special educational needs face even greater obstacles to accessing an inclusive education. Inclusion-driven reforms must consider the multiplicity of barriers that face children from the Roma community, particularly those with additional needs. Briefly consider some further points. So as Bulgaria moves towards a more inclusive model, our findings highlight the critical role that continuous professional development and training can have in fostering more positive attitudes among kindergarten teachers. One of our key findings was that those teachers with previous training in inclusion had more positive attitudes, particularly those who had the training at pre-service level. Training programs that target cognitive attitudes in particular may be useful, as this dimension was generally the least positive among the three dimensions. However, all dimensions are positively related to one another, so it is likely that targeting any one dimension will nurture more positive overall attitudes. We consider it essential for pre-service teacher education to incorporate inclusion-focused preparation so that teachers are well equipped with skills to facilitate inclusion in the classroom, but also so that positive attitudes are cultivated among new generations of teachers entering the educational system in Bulgaria. It is crucial to note, however, that teachers cannot be expected to facilitate inclusion or to hold more positive attitudes towards inclusion without structural support from the Ministry of Education and the ongoing prioritization of inclusion in teacher training. Reforms at policy level must be systemic, and school networks must be offered meaningful support and guidance in order to implement the inclusionary practices that are being embraced at the legislative level. Consideration is also urgently required for Roma students to access education, particularly those with special educational needs who are rarely able to access kindergarten. The training and development of teachers from the Roma community would help to promote feelings of safety and belonging for young Roma students coming into the school. And this can be seen as inclusive practice in the broader sense of the term, which is really important for us to highlight. And that is the inclusion of all children into mainstream education, irrespective of their individual educational needs, their ethnic background, or relative socioeconomic status. As I highlighted at the beginning, understanding this distinction between mere integration and full inclusion is central to our study today, and is the ground on which we seek to develop inclusive practices and inform meaningful legislative reform in the educational arena and beyond. Thank you so much.